Good afternoon, everyone, and thank you for being here for this webinar on the impact of the coronavirus pandemic on the Australian economy. To those of you who are joining us from Hong Kong or Singapore or places in those time zones, good morning to you. And to anyone who's watching a recording of this, perhaps you're in Europe or North America or Latin America, and obviously don't want to be up at some ungodly hour of the morning, well, thank you for watching this whenever you're watching it. I'm now going to share my screen so that you can see the slides that I intend to work through. Hopefully you can now see the screen. And let me just run through quickly what I want to talk about in the time that we have. First of all, I'll say a bit about the virus itself. I'll talk very, very briefly about the world economy. That's not the main subject today, although if you do want to ask questions about the world economy, feel free to do that when we get to question time. And if there's enough interest, maybe we'll schedule another webinar to look at the world economy and some of the major constituents of it. The main focus here today is, of course, on the Australian economy and the way in which the Australian government and state governments and the Reserve Bank have responded to that, trying to minimise the harm inflicted on individuals and businesses during the shutdown period, and then to chart a way out of the hole we're currently in to some kind of economic recovery. And then I'll finish by just going over some longer term considerations that I think might emerge from our experience of this pandemic, and then it'll be time for your questions. Before I go on to the substance of the presentation, however, let me stress, as I always do, that nothing that you're about to hear in this webinar constitutes investment advice, and it shouldn't be construed as such. If you think I've given you an investment tip, then you almost certainly haven't understood what I've said. And before you make any investment decisions, you should consult with your own personal financial advisor who understands your personal circumstances, and you should see anything I'm saying today as being very much of a general nature rather than specific to your personal circumstances. So with that health warning on board, let's turn to the first topic, which is a quick look at the progress of the COVID-19 virus itself. As this chart, which looks at the global situation, shows, last week there were almost 1.9 million new confirmed cases recorded, which is more or less in line with the numbers that we've seen over the past 6 or 7 weeks since the end of July. It brings the cumulative total to about 26.5 million. Interesting that although the number of new cases has been holding at about 1.8, 1.9 million a week since the end of July. And of course, that's the highest level that's been recorded since the pandemic first appeared earlier this year. The number of deaths has been lower than the peak that occurred in mid-April. That may be because this most recent round of infection since the beginning of July has impacted more young adults, people in their 20s, than the first wave. And we know that it isn't as fatal for people in their 20s or 30s as it is for people who are aged 60 and especially 70 or above. I think it's also the case that the medical profession and others who care for those who've been infected with the virus have got better at understanding how the disease affects people and what they can do to minimize the risk that people will actually die of it. And it could also be, of course, that the virus itself is changing in ways that perhaps make it more infectious, but less fatal than it was in its early stage. That's something that epidemiologists and health researchers will, I dare say, be devoting a lot of their time to, not only at the moment, but after this is hopefully all over, and they're seeking to draw lessons that they can apply to the future pandemics that we'll inevitably experience. I think it's notable that over the past 2 months or so during this so-called second wave, 9 countries with about 1/3 of the world's population have accounted for almost 3/4 of the cases that have been reported. Those 9 countries are the United States, India, Brazil, Peru, Mexico, Colombia, Iraq, Indonesia, and the Philippines. Most of those have fairly large populations. Some of them don't. I've shown 22 countries on this chart, including some others like Chile and Egypt, Saudi Arabia, and Qatar, which is actually a very small country, as you probably know, but nonetheless has had a very high number of infections during the last couple of months. And if you look closely at that chart, you can see that in most of these countries now, the number of infections appears to have peaked, but it's still rising in India in particular, which is probably going to overtake the United States as the country with the most number of cases at some point in the next month or so. The number of cases is also still rising in Peru after having apparently paused, and closer to home, it's still rising in Indonesia. And that's obviously of particular concern. Indeed, in Indonesia, as in some other countries, I'd be fairly confident that the number of infections is somewhat higher than is officially reported because of the low level of testing that the Indonesian authorities are actually undertaking. But at least in most of the world's countries where the largest number of cases have occurred, with those exceptions of India, Peru, and Indonesia, it does look as though the second wave that they've experienced has peaked, and hopefully that continues to be the case in the weeks ahead. Here in Australia, where we've certainly had a second wave centred on Victoria, the number of new infections has clearly slowed since the first week of July. The number of active cases is now the lowest it's been since early July. Unfortunately, the number of deaths is still increasing. Indeed, the number of deaths last week was the highest in any week since the pandemic in Australia began back in the middle of March. But of course, we know there's a period of at least 2 weeks between when someone catches it and when, if they do pass away, that actually happens. So all being well, we should see the number of deaths start to decline very soon, within the next week or so, and I certainly hope that is the case. As I mentioned, this second wave has been very much concentrated in Victoria and largely results from failures on the part of the Victorian government in administering the system of hotel quarantine for people arriving in Australia or Australians arriving from abroad. New South Wales faced a similar risk profile to Victoria, with Sydney being the other main point of entry into Australia, apart from Melbourne, for people coming to this country. But whereas New South Wales accepted the federal government's offer of using Defence Force personnel to